Well, it's time for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with some new information on sleep and our immune system. Linord.
And that's right, Vincent. A new study says not getting enough sleep can make you sick. Writing in the journal Sleep, researchers from the University of Washington say sleep deprivation depresses the body's immune system. To reach their conclusions, the researchers studied 11 pairs of identical twins with differing sleep patterns and found that the twin who slept less had a depressed immune system. Researchers noted that genetics account for 31% and 55% of sleep duration, with behavior and environmental making up the rest. They say existing data on limited sleep deprivation in a lab setting can increase inflammatory markers and activate immune cells, but that less is known about long-term sleep deprivation in natural conditions. Now, the World Health Organization says tobacco control policies not only saves lives, but also could generate significant government revenues for health and development work. In a report released recently, the WHO says there are about 1.1 billion smokers aged 15 and up, and around 80% live in low and middle income countries, with 226 million living in poverty. The almost 700-page document was produced in collaboration with the U.S. National Cancer Institute. Medical experts say smoking can cause diseases such as lung cancer and heart disease. Tobacco products cost the world's economies more than $1 trillion annually in healthcare expenditures and lost productivity, and kill some 6 million people each year.
This monograph on tobacco control economics is significant in two ways. From a public health standpoint, tobacco use kills 6 million people every year. But from an economic standpoint, the cost of tobacco use is more than $1 trillion every year for lost productivity and healthcare expenditures. Tobacco control measures can easily be implemented in low and middle income countries because they're very cost effective. These measures include significant tax and price increases, marketing bans on tobacco industry marketing, smoke-free policies, pictorial warnings, and the like.
And the WHO's head of Tobacco Control Economics Unit adds that the monograph on tobacco control and economics can be used by governments to ramp up tobacco control. Now, the demographic dividend is listed as a top priority at the ongoing African Union Summit. UN experts say over 30% of Africa's population is comprised of young people, which is considered an asset for the continent. Observers say when the number of working-age people surpasses the number of dependents, African countries can experience an economic boom, a demographic dividend. VOA's Khalil Gay reports on how this is being addressed in Mali.
In the wings of the Afrique-France Bamako summit, the Malian Ministry of Youth has invited some 20 African youth ministers to discuss ways of achieving a demographic dividend. The meeting, co-organized with the Mali office of UNFPA, started with a fully attended workshop on strengthening the knowledge of youth and adolescents on sexual and reproductive health.
If you don't take care of your youth, who will be the leader tomorrow? If we have a chance to be where we are, because we had a chance to be educated, we had a chance to have some opportunities, and that's what we have to put in our children and the other children to really have the capital of human capital in front of the agenda.
Access to health and reproductive services, ending child marriage, early pregnancies, sexual violence and female genital mutilation set the scene for the local arm of UNFPA, whose philosophy is to invest in Africa's youth in order to make them the actors of their own change.
I feel that this movement that has begun can also impact positively on other countries and other regions that are also looking to harness demographic dividend with youth.
The host of the meeting, the Malian Minister of Youth, urged efforts to help achieve a demographic dividend with a healthy youth. Mr. Mabinge Ngom, UNFPA Regional Director for West and Central Africa, went even further.
High population growth can be a threat to peace, security, and stability. I also believe that high population growth will make weak or fragile governments, fragile state, even more fragile. So I think there is a case for population growth to be taken much more seriously, and there is a case for population growth to not be seen as a development issue, but also as an instrument for building resilience.
So, an emerging Africa will remain but a dream if the lowering of fertility is not accelerated, and that will necessarily require significant investment in the sexual health of youth and adolescents.
The youth in Mali is well aware of their position on the road to the demographic dividend, and that's why they're asking to be fully involved in decision making. Khalil Gay for VOA News, Bamako.
That's our health report for today. To stay in touch, find me on Twitter at Linord Moudou.